Hello, my name's Bob Doman. I'm the founder and director of the National Association for Child Development. This video is part of a series of videos we have relative to children with Down syndrome and issues that are affecting them and things that parents and therapists need to be aware of, understand, and address. All right. In a previous video, I talked about issues with structural problems relative to ears, tonsils, palate, and so forth. Also discussed issues relative to different components of hearing and processing sound. In this segment, I'd like to talk specifically about auditory sequential processing. Sequential processing is a huge deal virtually for everyone, but it's a very, very big deal for our children with developmental problems, and particularly our children with Down syndrome. Auditory sequential processing is how many pieces of information you can process, understand in a sequence. For example, if you can say to your child, "Johnny, touch your nose," Johnny is processing one piece of information. If you could say to the child, "Johnny, touch your nose and your ear," Johnny's processing two pieces. Say, "Johnny, can you touch your nose, your ear, and your chin?" Johnny processed three pieces. If you can say, "Johnny, say blue, red, yellow," and Johnny can repeat that, he's processing three pieces. Knowing where your child's sequential processing is a very, very vital piece of information. Your child's language function is going to be a reflection largely of their sequential processing. Sequential processing is directly correlated. And generally what we see is a child who can process one piece has a few words of speech. A child who can process two steps sequentially has quite a few words, maybe 25, 50 words, and is starting to put together couplets, putting two words together, and very, very initial three-word phrases. A child who can sequence three is speaking in phrases and very initial sentences. A child who can sequence four, we're getting 4 or 5-word sentences. And when the child can sequence about 5 pieces auditorily, sequentially, we're getting conversational language. If the child does not have the sequential processing, no matter what you do, you're not going to develop language skill that is superior to the processing skill. Because the processing determines how many pieces of information your child can hold together in their brain. Language function, speech issues are a very, very significant issue for most of our kids with Down syndrome. Understanding the importance of sequential processing is vital to addressing these issues. Through the course of the past 40 years of my work, we've developed literally hundreds of different techniques and methodologies to try to build sequential processing. And most of our families who have children with Down syndrome are very aware of the significance of sequential processing and are very, very active participants in many different ways of working to develop that sequential processing. Part of what is important relative to this is not just the language component, it's the cognitive component. Essentially, your sequential processing is what is referred to as your short-term memory. Your short-term memory is the basis of what's then called your working memory, how many pieces of information you can hold together and mentally manipulate. And your working memory is the basis of your, what's called executive function, or real cognitive function, or your ability to think, which is taking information in, manipulating that information, bringing the information from long-term memory, and then thinking. That cognition is ultimately what's going to determine your child's level of function. It also is what, as you proceed with your child, is going to determine their global level of maturity. If you have a child, for example, who can sequentially process 3 pieces of information at 3 years of age, your child pretty well would be functioning with his peers. If your child's 6 and has sequential processing of 3, your 6-year-old is essentially globally functioning about where most 3-year-olds are. And if your child's 12 and is processing a 3, your 12-year-old is kind of globally functioning where a 3-year-old would function. Now, your child can learn skills, you can develop skills, but in terms of their ability to think and their ability to communicate and global function is really dependent upon their level of sequential processing. So this is a very, very big, significant issue, and something that every parent, every therapist, every educator working with children with Down syndrome needs to understand. Okay, thanks.